Hello, my name is Christian Park, and I did my presentation on asthma. Asthma is a chronic condition in which your airways swell up, become narrow, and get filled with mucus. A person might experience symptoms of coughing, wheezing, or chest tightness, making it extremely hard to breathe. Some factors that can trigger asthma are pets, pollen, smoke, cold weather, exercise, strong smells, mold stress, and respiratory infections. This chronic condition can start as early as someone's childhood. It can develop over time as you become an adult. About 1 to 12 people have asthma in the United States, which is equal to 28 million people total. There are many different types of asthma based on the symptoms you experience. For example, cough variant asthma is only experienced through coughing. Exercise-induced asthma is when you only experience asthma when exercising, and allergic asthma is when your allergies only trigger asthma. The reason why I took interest of this chronic condition was because it was one of the most common chronic conditions that affect many people's lives. Asthma is one of the leading reasons why students or adults miss school or work days. Understanding the pharmacology behind this chronic condition is important. If asthma is not treated properly, it can become fatal. Having this condition requires lifelong management and needs to be watched closely to ensure a happy, healthy life. Many patients are in need of long-term medications to manage their symptoms, making asthma an important condition to study. Asthma has had such a big impact across all age groups across the world. Asthma is caused by many factors like genetics, the environment, and your immune system that leads to chronic inflammation and narrowing of airways. According to the American Lung Association, if you have a parent with asthma, you are 3 to 6 times more likely to develop asthma than someone who does not have a parent with asthma. They have also stated that certain allergic conditions such as atopic dermatitis, also known as eczema, or allergic rhinitis, also known as hay fever, are linked to people who get asthma. Viral respiratory infections during infancy and childhood can cause wheezing. Some children who experience these infections go on to develop chronic asthma. Being exposed to certain elements in a workplace can cause asthma symptoms, also known as occupational exposures. Smokers have a higher risk of asthma. Smoking worsens asthma as it irritates the airways. Those whose mothers smoked during pregnancy or were exposed to secondhand smoke are also more likely to have asthma. Obesity is one of the leading causes, though. Children and adults who are overweight or obese are at greater risk. Even though no evidence is set, some experts point to low-grade inflammation in the body that occurs with extra weight. Obese patients often use medication, suffer worse symptoms, and are less able to control their asthma than patients in a healthy weight range. Some things that may trigger asthma are strong emotions or stress, cold air, sulfites and preservatives added to some types of foods and beverages, gastroesophageal reflux, and physical activity. Certain medications like beta blockers, aspirin, and non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen sodium can trigger it as well. Asthma is a very complex, multifactorial, chronic disease that is influenced by over 100 genes and environmental interactions, rather than a single mutation. Asthma's genetic components include the immune system, more specifically its Th2 pathway, and chromosome 17q21. These chromosomes are strongly linked to childhood onset asthma. This affects the airway remodeling and metabolism. The molecular pathways include airway inflammation, remodeling, and bronchoconstriction. There's even more genetic and molecular causes like alarmin cytokines. Genes like IL-33 and IL-1RL1 are associated with the atopic asthma. This is like allergic asthma. Neuroimmune interactions are present as well. TSLP is identified as a major factor, with specific SNPs influencing asthma risk. Epigenetics go beyond DNA sequences. DNA methylation plays a crucial role in mediating how environmental factors affect gene expression. When a patient is being diagnosed with asthma, doctors try to rule out other conditions that can cause similar symptoms. Although asthma doesn't seem to have single central cause, there are easy conditions doctors can rule out. Doctors may rule out chronic obstructive pulmonary disease. This disease looks much like asthma but usually occurs in long-term smokers. This disease limits the person's airflow, and pneumonia is also another lung infection that causes symptoms like wheezing and coughing. One of the most common, though, is bronchitis, which is inflammation of the bronchial tubes. Sometimes doctors can even rule out something that doesn't pertain to the lungs mostly. For example, heart problems can give someone a hard time breathing. Someone with heart problems may experience shortness of breath and mistake it for asthma. There are many psychological factors that come with asthma. Bronchospasm, for example, happens during asthma attacks and essentially almost close off airways by contracting smooth muscles, making it harder to breathe. This is not something you control because smooth muscles are involuntary muscles. They move by themselves. And mucus is also hypersecreted by these goblet cells, making it thicker than usual and clogging the narrow airways. There are also chronic long-term physiological effects that come with asthma. Airway remodeling is repeated and can cause permanent structural changes like fibrosis, and fibrosis is like scarring, membrane-based thickening, and muscle bulk. Over time, your lungs may take in less oxygen than before and would impact your overall physical fitness. Not often, but possible, your airways narrowing can become permanent, which is also a common thing in chronic obstructive pulmonary disease. Asthma's inheritance is multifactorial, and it does not follow simple Mendelian patterns. Instead, it results from multiple genes interacting with environmental factors. It is impossible to find a distinctive pattern because there are over 100 plus genes that are involved with asthma, affecting immune response and lung development. Again, children with one parent are 3 to 6 times more likely to develop it, and 70% if both parents have it. To conclude this presentation, asthma is a chronic disease that swells up your airways. Asthma affects many people's lives globally, and it is a widespread problem. While asthma currently has no long-term cure, it can still be effectively managed through avoiding triggers and utilizing medication. Asthma symptoms are mostly moderate, but if not treated or ignored, asthma can become fatal. There's so much research still to be done on this disease. And here's my works cited.